Hi, everyone. Thanks for joining us. My name is Reed Humphrey. I'm the VP of Technology Consulting at Canopy Partners. We're the commercial IT services division of Radiology Partners. I'm joined today by Dr. Mike Brown, who's the Director of AI, who assists our business development team in meeting with hospital health system clients and helping educate them on our AI program. Dr. Brown, thanks for joining us. Perhaps you could just tell us a little bit about which practice you're with and your area of specialty.
Thanks, Reed. I'm currently with Greensboro Radiology in the Emergency Radiology Division, and I'm excited to report that we're currently one of the sites that has the RP AI program live and using it in clinical practice. So I'm looking forward to talking to you about some of the highlights of the rollout of that program.
That's great. Thanks, Dr. Brown. We're going to jump right into it. This is intended to be an internal education video. So we're going to kind of take it from our perspective as a practice, not from the hospital's perspective. Just to kind of quickly share with you about our AI program, it's very different than anything that's being offered in the market. We're actually assessing all the different AI vendors, curating different algorithms that we think have value. We're making sure they're FDA cleared, we're vetting them, we're doing pilots on them, we're testing them at scale. And we're validating the data sets and continuously monitoring and revalidating it to make sure that the AIs continue to perform as needed and it doesn't drift. We also handle all the implementation, project management, training and change management for clients. Most health system clients haven't done this before. They haven't implemented a large-scale AI program for radiology. So we can kind of hold their hand and help them through this and be a good partner for them. We also on the back end handle all the support, and not just for maybe one or two products, but for all the different things that we're bringing to a client. Today, we're partnered with ADOC. In the future, we're going to have many other AI offerings. But if you think of it from the client's perspective, over time, they may have 10, 12, 15 different AI algorithms in play, maybe more. And then we have to learn to use those as a practice. What we can do is streamline that and bring it all together with one connection, one phone call, make it clinically integrated within the workflow so that's not a bunch of different widgets. So there's huge value in doing this as a single source provider for the client. And then not just helping with detection and triaging of cases with the AI, but also helping with the care coordination downstream, making sure that these patients get the care that they need and get navigated properly in the organization. And if follow-up is recommended, making sure that they get that appropriate follow-up care and come back in when they're supposed to for their next exam. We also have a customer success management program where we meet with clients regularly to show the value that this AI is providing for them, making sure that it's delivering the benefits as promised to patient care, and also the financial return on investment, which we'll touch on a little bit later. So this is a full turnkey solution that we're providing for clients, and it's very unique in how we're positioning it. We already have several clients that are signed up. We have 4 that have currently signed. We have many, many more that are in our pipeline right now, and the conversations with them are going exceedingly well. They seem to understand our value proposition and what we're offering, and they see the benefits from this. So it's an exciting conversation to have with clients. The clients that you see on the screen here, 3 of the 4 are currently live and are already seeing benefits to patient care. Some of them are even asking us how we can help them market this and promote it and tell the story in their community, because they're providing a new elevated standard of care, which they're really excited about. To kind of give you a sense of where we're going with our roadmap, we're actually looking at this in 3 different silos, if you will: acute care, outpatient, and what we call patient retention. In the acute care silo, we have our FDA cleared algorithms from ADOC. ADOC is our primary partner here, and all of these are currently available for clinical use. The clients that I just shared, all of them have access to every one of these modules, and they're live and in clinical production today. In the outpatient suite, you can see that the items in black are currently available for clinical use, and the items in blue are awaiting FDA clearance, which we hope to have approval on soon. We're particularly excited about a new partnership with a company called iCAD that's going to provide screening mammo AI for us to help with not only the detection of AI and density analysis, but also in the prediction risk of future breast cancer. So this is a new partnership that we are about to finalize and will announce in time for RSNA. We also have a patient retention suite. And in this suite, we're looking at our follow-up, like incidental follow-up program, acute care coordination. We also have some imaging operations AI to help with things like automated patient self-scheduling, as well as MR-PET throughput. We got some technology that allows us to kind of enhance and accelerate the time that it takes to process an MR or PET. And then that way it can get to the radiologist quicker. We get the patient out of the, off the scanner quicker, and we can get that next patient in. So it actually helps drive more revenue for the health system downstream because they're able to move patients through more quickly. And then we actually have our own reporting tools that we've developed, like RecoMD, for best practice recommendations. And we consider this, it's kind of a combination of natural language processing and AI, but it's a proprietary AI solution that we've developed to make sure that we make the right call and make all the appropriate recommendations consistently whenever we're reading a case. So these are some things we're bringing to the table. It's a highly differentiated approach, and it's going to continue to expand over time. We're excited again to share this story with our health system partners. I'm going to turn this back over to Dr. Brown now, who's going to kind of discuss really why we're here today and help provide some internal training in terms of some of the clinical value and use cases that we're seeing from this technology. So, Dr. Brown, I'll turn it over to you.
Thanks, Reed. Yeah, we're going to show you some examples today. Really, why are we here today encompasses looking at these AI algorithms and showing how they're going to impact our day-to-day clinical practice. And obviously the high visibility examples are going to be some of the more acute care algorithms that we employ, but just understand that while it's tougher to show some of those outpatient and non-emergent and patient capture algorithms, those are equally as important for the whole picture as part of the RPAI program. So what we have here are just two simple images through the lung bases, and for the astute radiologist who's going to look, they're going to see that there are some filling defects identified by those red arrows there within the pulmonary arteries. And there's two things to really identify on this exam. One, the contrast enhancement within the pulmonary arteries is not spectacular. I think most of us would agree that it could be better. But two, you can see some abnormalities in those pulmonary arteries that correspond to pulmonary emboli, filling defects that are clinically important for the patient. Now, as we go on to the next slide here, what I'm going to demonstrate is that this was not a study done to primarily identify pulmonary embolus. This was actually done on a patient as a CT abdomen and pelvis protocol, where we would routinely get portions of the lung bases. Contrast was given, and as part of this, the AI algorithm that was employed recognized that the lung bases were involved, that contrast was given, and the algorithm was run in order to detect an incidental pulmonary embolus. And in this case, while is a subtle finding on just the straight radiology CT image, when you add the heat map image there to the right, that will guide the radiologist's eyes directly to the finding, you can see that this would augment the radiologist's ability to identify what is really an unexpected finding on this exam. And there are studies that show upwards of 40% of these can be missed by radiologists during the course of normal examination. And so when you add in the ability of AI to help us identify this, there are downstream impacts that are going to be capturing this patient appropriately when they present so that they don't have to be discharged and readmitted later with potential pulmonary symptoms. If they're admitted to the hospital, identifying this early and instituting treatment immediately can decrease their length of stay, whether that's time spent in the emergency room or time spent on the floor of the hospital. Those are both valuable things that we can do to help the hospital with throughput. Increasing intervention when appropriate for a high volume pulmonary embolus that would require thrombolysis, identifying that quickly can get the patient on the table faster. And again, the output at the end is ultimately the patient outcome, hoping to save lives and have better quality of life. So with artificial intelligence, just like anything that we employ throughout the healthcare system, we really have a a quadruple aim here. And what we want to do, and I'll go through each of these quickly just to identify what we mean and what we're going to have as an output as part of instituting an AI program like RPs. Ultimately, when we add something new into the system, what we're trying to do is reduce costs to the healthcare system while improving the health of the overall patient population. We can improve the experience that the patient has in the hospital system and also improve the staff experience within that system as well by instituting these AI programs that we're going to talk about today. When we talk about reducing costs, what we really want to do is increase value. So spending a little bit of money on an AI program can add value down the road by improving the patient outcome, improving the population health for the patient population that healthcare system deals with. Improving the staff experience can be something as simple as improving efficiency. For a radiologist, that means being able to identify pathology quicker, getting an abnormal study presented in a more timely manner, and reducing turnaround time. But it can also mean making sure that the technologists, the scheduling staff, for some of those things that Reid just talked about, as far as getting the patients on and off the table quicker, or getting the patients scheduled for their follow-up of a known abnormality in a more timely manner. Those are all things that are really important for the mental health of the staff that's going on, and for the radiologists to make sure that our jobs are easier and that we reduce burnout. And for the patient experience, they want a higher level of service. And if we can provide that by putting in the same amount of effort that we have already and using that effort in a more timely way to get that turnaround time decreased or get that abnormal study results back to the patient and their physician faster, then we can really expedite the level of care and increase the level of care to that patient that they otherwise may take longer to get. So I'm going to go through a couple of high visibility examples here, and these are going to be some acute examples, and these are going to be images that were actually called from some of the background validation that Reid mentioned, that the RP-AI program really has demonstrated the utility and really helps us going in with a hospital system to identify the usefulness of what an AI program can offer. So that image on the left, a patient presented with trauma, and you can see some subtle soft tissue swelling over the left frontal scalp. And those arrows identify a very subtle left middle cranial fossa subdural hematoma. And in the course of reading a study, if this just popped up amongst a list of another 10 or 15 head CTs, this is a subtle finding that could easily be missed. When you couple it with the heat map that the AI algorithm is able to generate and would present prospectively when this is implemented to the radiologist, you can see how the radiologist's eyes would be drawn to that region to make sure that we didn't miss this subtle finding. The reason that that's important, as we're going to outline here, these subtle findings can progress. And so what we want to do for the patient is have the downstream impact of decreasing the time that they're going to spend in an emergency department or in the hospital, but identifying the subtle abnormality so that they can get admitted properly, be observed properly, so that if this does progress, we can limit the invasiveness and the expense of the treatment that they would need in order to be adequately evaluated by the clinicians on the floor. This is going to be a common theme you'll see with the downstream impacts today, is what we want to do is avoid misses, but we also want to make sure that we get the patient the best treatment in the most timely manner. So move on to the next algorithm is cervical spine fracture. And I think this is an important one because what's in a trauma setting, we all would like to think that we would never miss a cervical spine fracture, but we do get images through the cervical spine for a variety of reasons. And this case is very illustrative of that. There's a C6 spinous process fracture nicely outlined by the arrows. The reason the sagittal image is displayed there is this is one of the few algorithms that's run off the sagittal data set and not off the axial data set. And as we moved in the next phase here to show you the heat map algorithm, you can actually see that we're going to hit the next slide there, Reid. This study was actually done as part of a CTA protocol of the neck in stroke. So even though this study was not done to look for cervical spine fracture, and this is an unexpected finding similar to what we saw on that incidental PE study that we led off with, it's an important finding. So a stroke patient may present having fallen down, not able to get a history of what happened. It's still important to find these things. So looking for unexpected pathology in a field of view and in the anatomy that's presented is where AI can help the radiologist really look for things that otherwise may be overlooked. And again, it's all about getting the patient to the appropriate acute care setting, admitted appropriately, and having the appropriate treatment done as expeditiously as possible. And the last case here, I think, really shows to the radiologist where this can help the efficiency in a long list of emergency studies. And practicing as an emergency radiologist with Greensboro Radiology, when we went live with this algorithm and the AI platform, this was one of the areas that was really exciting to me. You know, you get a CT scan of the chest, and a routine CT can be anywhere from 100 to 150 images. But when you start getting into thin section CT angiography protocols, especially in a multi-trauma setting, you can have thousands of images to look through. So in the setting of an isolated non-displaced fracture like we see here in the left sixth rib, it's certainly easy to bypass that when there aren't associated findings of effusion or pneumothorax or contusion. But where the heat map here can show you to direct your eyes to that one area to make sure that you don't miss this finding. And the reason that this is important is because we want to find this pathology, not because it's going to require any immediate treatment, but because, as the next two boxes that will open up here show, we can prevent downstream costs to this patient and to the hospital system. If they're admitted with an undiagnosed rib fracture, they can continue to have chest pain that would necessitate maybe a nuclear medicine cardiac study or a repeat CTA of the chest looking for pulmonary embolus, or just a simple follow-up CT to look for something that was not diagnosed initially. So while this may seem like a very subtle or not clinically relevant finding, it really does have downstream implications of why this is important. So now that we've gone through the actual nitty-gritty of what the AI algorithm output, let's look at what it looks like to the radiologist as we're sitting in a work list. So this is a simulated work list on a PACS system, similar to what we all see. And you can actually configure this in many different ways when it's placed in your institution. So in this case, what's highlighted here is that an algorithm has been run, and that little orange box that's under the flag column is signifying that there was a positive finding. So when we look at the next slide here, I'm going to show you the 3-monitor setup that's kind of standard for radiologists. The left monitor is typically the non-diagnostic that has the work list and maybe your VR software. That little orange widget is the overlay for the artificial intelligence program. And the reason I like to show that in such a tiny little window there is that it actually shows you how unobtrusive this can be. And I was a little worried in starting instituting this, and I will tell you that within 20 minutes of starting to read with AI, you figure out where you want your widget, you figure out how you want to interact with it, and it becomes really a part of your search algorithm that you use for the rest of the study. When there's a study that's open on PACS, as the next slide shows here, the images display normally on PACS, and that little widget turns into a ribbon. And that ribbon is going to display the patient identifying information and is going to show you exactly what algorithms ran. The little orange dot is going to show you if it was positive. It actually has a nice little subtle pulsing effect when it's live on your screen. And the null symbol is going to show you that there was an algorithm run that had a negative result, meaning there was no rib fracture in this case. When you hover your cursor over top of that ribbon, as the next slide shows, you actually get the actual CT slice that's going to show the abnormality. And in this case, it's very subtle. There's a subsegmental pulmonary embolus, but you're actually able real time to toggle back and forth between those heat maps that we saw earlier and that clinical image that's there. That way, when you go over to the PACS system to primarily do your interpretation, you know exactly where in the study to look, and you can have the benefit of having this information presented as soon as the study's open and be able to know what you're dealing with right away. So we've shown all these benefits of the RPAI program. We're avoiding errors, we're reducing costs, we're making sure we get the right treatment in the most expeditious manner. To the hospitals, we're showing return on investments on the order of 3 to 5x. And to the patients, we're trying to save their lives and get their diagnosis faster. So you may ask, well, why isn't everybody doing this? You know, what are the hurdles that are there that are preventing this implementation, and why is the RPAI program with Canopy going to help overcome that? And there's classically 4 big reasons why new technology, including AI, is difficult to roll out. For AI in particular, trust has been lacking. There were some early examples that had a lot of high promises that didn't have a lot of matching results. And so the solution that we have here at RP is that we've had background validation that's occurred. And on an annualized basis, this is over 10 million exams. You can go ahead and click right to bring up that solution. And so what we've done is we've ensured that these algorithms are going to work within your practice, as Reed talked about. This is not a data set that the vendor utilized in an academic setting. These are actually real patients that we run these algorithms on to show that we get the intended outcomes. For any new technology to be adopted, there's got to be an impetus. There's got to be high visibility, high value examples. And I think we've shown you some of those today, and these have come from the background validation process that RP has undergone with these different vendors and different algorithms, so we can see the direct patient and radiologist benefit. As we all know, radiology workflow is really not designed to integrate anything additional, including AI functionality. But where RPAI program and Canopy have really excelled is because this has been deployed in multiple environments. And we've been able to develop seamless workflow for everything from technologists to referring clinicians to the radiologists. And that AI widget that I showed you there really is an example of how we're trying to take into account the radiologist interaction to make sure that this is something that is useful and not detracting from anything else that we were doing in our clinical practice. As far as hospital organizations, we all know that IT resources are scarce, and managing an AI implementation can be daunting for somebody that doesn't understand exactly what's involved. RP and Canopy make sure that we have adequate resources from deployment to integration to the ongoing validation and customer success management that Reid talked about earlier, so that this really is a one-stop shop to get everything accomplished and meet all of our goals. So I'm going to turn it back over to Reid now for a little discussion of that return on investment that the hospitals like to see.
Thanks, Dr. Brown. So I'll take a few moments to talk about the financial return from our AI suite. This is an example that we've modeled based on a health system with 500,000 exams. In this case, a facility would typically receive an ROI of around $1.5 million a year. And that's significant in a time when, revenues are really tight in health systems. So if you can put back $1.5 million into their coffers, it's something that they're going to pay attention to. We're basing this return on investment on only 3 of the 10 algorithms. We're using ICH, LVO, and PE. The reason we're basing it on these 3 is that we have a lot of data and case studies independently published to show these numbers and to build a model around it that we can share with the health system, and they can use this to help build their own model. What we're not doing is factoring in the other 7 algorithms, because we just don't have enough history or data on those yet. But once we do have it, then all that will be additive to the return on investment. But just on the 3 out of the 10 algorithms, we're able to drive this $1.5 million a year ROI. The main levers are reduction of inpatient length of stay, an increase in appropriate admissions, and also a reimbursement from a program called NTAP, which is a new technology add-on payment, which is a hard dollar direct reimbursement to a health system that is using advanced technologies like AI to help detect stroke. So that applies to the LVO module only. But there are very significant numbers here that we can substantiate. Happy to go over the model with anyone at your health systems. I would also point out, as you see on the bottom here, that the estimates do not include any potential savings or mitigation for medical malpractice risk. This could be the biggest impact of all. Even one med mal claim saved could be worth more than $1.5 million a year to the facility. But we're not factoring in med mal in this, although it stands to reason that this could have potentially favorable impact for the health system on their medical malpractice risk. We also are backing this up with the largest radiology AI and IT services team in the country. Across RP and Canopy, we have over 600 people that are dedicated full-time to radiology IT. We're not aware of any other organization in the country that's got a team of this size. Even a large health system like HCA, they may have thousands of people in IT, but they don't have thousands of people or even hundreds of people in radiology IT. So, our team is uniquely experienced at this, and we've got a skill set and scale and resources unlike any other organization. And we're putting a ton of investment and time and energy in AI, so we can really bring a lot of expertise to our health system partners and take a lot of this lift off of them and handle it for them. Obviously, with our scale as well, supporting over 3,000 radiologists, 3,700 sites, and 45 million exams, we're just able to bring a perspective that no one else has in the market. And lastly, why should we be out talking to our health systems? Well, there are a lot of AI vendors out there. If you've ever been to an RSNA show, there's an entire floor with probably over 100 AI vendors, and they've all got their different things that they're peddling, they're out there talking to our hospitals. So if we're not talking to them, they still are. And we really need to make sure that we're getting in front of them and making them aware of what we have to offer, so that our hospital partners want to come to us and maybe give us the first first right of refusal to have a conversation around any AI solutions. And again, the benefit of doing this with us, not only are we their radiology partner, but from a technology standpoint, we can bring all of the AI together for them through one connection and then support it for them. Whereas if they're buying this from the different vendors in the market, they may have, a lot of different hands in the pot, different servers, different calls they have to make for support, different contracts. It just makes sense to streamline this and work with us in this space. So it's a great message. It seems to be playing well. We've just got to get it out there to more of our hospital executives. And that's really where we're asking for your help. So in terms of next steps, we'd like to ask you to consider the following. Find an AI director like Dr. Brown here. Others are Dr. Ashok Gupta from Desert Radiology and Dr. Shreyash Krishnan from Greensboro Radiology. Connect with them to learn a little bit more about this. And make sure that you kind of understand what we offer and how to communicate it to your hospitals. We welcome the chance to talk with some of your local practice boards and share with them what we're doing with AI, maybe even provide a demo for them so that we can get more support and visibility from the radiologist in your practice. Perhaps select an AI champion from your group that, kind of one designated rad who maybe likes technology and would like to kind of be the internal champion for your practice. And perhaps we could even pilot this within your facility, or you could be a pilot site not only for what we have today, but also from some of our new upcoming initiatives. So we'd love to work with you in that capacity. And then feel free to reach out to our Canopy Partners team as well. You can contact myself or Saunders. Anyone within our business development team could help you with this. So we'd love to speak with you about it. And mainly, we just need your help in getting meetings with your health systems. We want to get in front of them and share this story. It's a unique story. It's exciting. We're right on the leading edge of what's happening with AI and helping to transform radiology. And but you have these relationships. And so if you can open doors, make introductions, help us get meetings with your health system administrators, that would be fantastic. So we would like to ask for your help there, and please let us know, if you've got a facility that's interested, and we'll work with you to get a meeting scheduled. So with that, I think we'll bring it to a close. Thank you all for tuning in. Dr. Brown, thank you very much for what you've shared with us today. We really appreciate it. Super insightful. And we'll let you guys go. Have a great day, and feel free to reach out if you have any questions.
Thank you.
Take care. Bye-bye.